And welcome back. And we are moving into our first conversation for today as we discuss the very important role of nurses in our healthcare system. We have with us this morning Agustina Elijio, who is the Deputy Director of Health Services with the responsibility of nurses. And we have the President of the Nurses Association of Belize and also a certified registered nurse anesthetist, Darrell Spencer. Good morning and welcome.
Good morning.
Good morning, madam.
First of all,
and happy Nurses Week.
Happy Nurses Week.
Thank you.
Thank you.
It is so nice to have you in, and it brings warmth to me. A reason for this is because nursing is caring. It's not anybody who would take on the task. You have to understand what you want to do and know for a fact that you love being around people.
Yeah.
So let's delve on into.
Yeah, I was gonna start with Nurse Elijio to kind of get a picture as to the nursing situation in Belize.
Yes.
Obviously, as your direct responsibility, you are working in terms of professionalism, recruitment, I believe. Talk to us about the current situation.
Very good question, and I'm happy to respond to that. But before I do, allow me to tell the nurses in Belize, retired and employed both in the private and public sector, happy Nurses Week.
Yeah.
Thanks for serving in this jewel.
Yes.
Wow.
If you have to look at nursing in Belize, and I will try to compare with global situation, we are being told in nursing that we must think global but work local, because whatever is affecting the profession out there globally is also affecting us here. Nursing in Belize represent 86% of the health workforce. Very big. So, we do have 727 registered nurse being employed, and we have roughly 257 practical, now called nursing assistants, being employed. I must say that 250 of those are foreign nurses. And that brings to nursing one of the challenges that we are having. And Belize, like globally, we are importing nursing. When I was a young nurse, that wasn't the case. We were trained at the Belize School of Nursing, and we serve the populace. But now things have changed. Globally, things have changed. We're having our population being enlarged. We're having the emergence of new diseases, the reemergence of older ones. Patients are demanding more. You know, so there are quite a lot of changes that have been occurring in the health system. And being the bigger portion of the health workforce, we need to be abreast. We really need to be abreast. We are being challenged with the developed country moving out our highly trained and experienced nurses.
I'm glad you touched that point, because that is perhaps a very long-standing challenge of the nursing industry in Belize. It's been there's been a global shortage of nurses, and so many times people come into countries like Belize to try to recruit our talents, and we've seen quite a number of nurses leave as well. Talk to us about how or what attempts have been made about being able to address this situation.
I would like to start even from the regional level, the Caribbean region. We do have strategies in place that we could attempt to retain our nurses. There's the whole aspect of the Caribbean single market economy, where we could have nurses coming from Trinidad, Jamaica, Barbados, working in Belize, and even more so because we share the same nursing curriculum in our School of Nursing. We sit the same regional licensure exam, so we are at the same page as it relates to not only your competence but also your skill set. So we are quite comfortable with that. There is also the bilateral agreements that we do have with Cuba and Nigeria that would come in and assist us with our shortage. So those are some of the strategies we have been looking at. Well, apart from others, what you rightly said, Marlene, this nursing shortage is a global one. It will not go away soon. So the Ministry of Health has to strategize and to look at ways in which we could retain our nurses. When we look at the developing countries, they're offering these nurses very good packages. So in terms of incentive, training is another area that we are focusing on, because nurses, it's not always only about the remuneration, but also people like to know that professionally they're growing. So that's another aspect that we are looking at. The whole aspect of climbing the career path, the career ladder is another aspect that we are looking at. And through the human resource, through the policy and planning unit, they're addressing that whole aspect of the human resource strategic plan. And we are hoping that quite a number of those areas to retain nurses would be in place.
Let me follow up with that, because I find it interesting. Belize was so far ahead of the game in terms of having the institutions in place to allow for the profession to grow, from the nursing school in the early days. Now the universities offer up to bachelor's level, I believe, right?
Yes, it is.
A nursing program. And it always seems that many people are venturing into the programs, but we still see the shortage. What would you say is the area that they're being lost? And either one of you can chime in here.
I could have some input as it relates to that. Nursing today is not really an attractive profession. Okay, so we're trying again to have incentive in place so that we could address those. Also, when we look at what was from the School of Nursing to the University of Belize, there have been some changes, and I must say that too have brought about, what the nursing image is today. I must say it has to be a good one. You are being highly trained. It's now at the baccalaureate level, and these nurses, they are being taught competencies. You have labs that you do, and you do have a skill set that you must have in caring for your patient. And what is now being added, and it also being placed at all School of Nursing, the whole aspect of attitude and caring that was alluded to earlier. We need to know how to put, or how to ensure that who are screened or who are accepted into the nursing professional do have that attitude, do have that caring.
One of the things that stand out to me, and being around, especially our younger people of today, career paths. Then again, you hear from your parents, one of the things you want to do is actually find the career path, or not even a career, and that's one of the questions I wanted to ask you. If the younger people are actually looking at this as a career, but getting over to it though, people are actually telling their younger ones, please do something whereby you'll have a sure shot of getting a job. Nursing, they're looking at that. Police, the same thing. BDF, the same thing. I think one of the things that don't happen enough is advocating for, going into schools and talking to kids, to the younger ones, in terms of this is definitely a career. We tend to put ourselves in a position whereby we just need a job, so we will go to nurse, or we will go to police, or we will go to BDF. It's more of a sure shot. Are we seeing this as a career, and why should we?
Let me put a little thought there, because it's your limitations to what you're asking for. We've transitioned from the Belize School of Nursing into the University of Belize. The amount of nurses that came from every output back in the day of Belize School of Nursing was 15, 16. Those were the bigger classes. We've now moved to an institution, the University of Belize, at the baccalaureate level, and the intakes are large. The output is a little bit less. That is one part of the problem.
So they're not completing the program?
The among completing and being successful, we're working on that to try to get that at a higher percentage. Also, we have to realize that change has happened. All this exposure now to the foreign market, and we can say at the discussion table, oh, it has to be people who are loving and caring and all of that, and that is good. And I hope that all nurses carry that character. However, at the end of the day, you have to watch at the financial level. How will it benefit myself and my family? How will it allow my family to go? And when you do those comparisons, that is one of the biggest, not destruction of nursing from Belize, because we're still getting that output, but then it makes somebody else's grass looks a bit greener.
Yes, absolutely. And I can imagine if someone comes with a fantastic package from the United States, it's probably, and they are a young nurse, not tied to the country as yet, it would be very attractive to leave. But let me divert just a bit, because I want to just talk about the fact you are a male nurse, and you are the head of the Nurse Association, and we can't neglect to point out that this is typically seen as a female-dominated profession. And I want to find out more about what got you into nursing.
Well, it still is a female-dominated profession.
Yeah.
I like to look at it as a human-dominated profession. Whether you're a male or a female, I would like to give over to younger kids. That shouldn't have a choice in what career you choose. Find something that you like. I was introduced to the medical department, may she rest in peace, by Nurse Jeannie Arthurs. And she was one of my first mentors to the Ministry of Health, to the health department. You find that I loved doing things, helping people, taking care of the sick. And so she encouraged me to, why don't you do nursing? At first I was like, really nurse, yeah, that's for girls. Like any 17-year-old would, man would, right? So, and then we got into the conversation, and from those early conversations, both myself and her son ended up doing nursing started in 1991.
Wow.
So the profession has nothing to do with whether you're a male or a man or a woman, a girl or a boy. We should look at a career, find something that you love doing, and that will increase that ability to do your job right, to do it most caringly, to do it with more joy.
Yeah.
I must add, 96% of the nursing population is female.
Yes.
So the others who are males, I must say, are very committed. We find out, generally speaking, that male nurses do give very excellent care. And like the females, they're at the helm of this health system, and they are making big strides, closing up a lot of the chasm that we have in health. When we talk nursing today, nursing doesn't only benefit nurses. We're looking at the impact that nurses do have in the health system.
Of course.
Absolutely.
You look at the preventative phase, you look at secondary phase, the community level, so be it primary, secondary, or tertiary level, there are nurses there, you know, moving the healthcare within this healthcare system that we do have. So with that said, it is a wise investment, you know, to invest in nursing, because at the ending of the day, the health of this nation will be determined through that noble profession.
Now, you know, it's so, we don't speak very often about some of these integral aspects of the healthcare system. And I'm reflecting on a conversation that we had yesterday with the BNTU leader. Mother's Day, Teacher's Day, Nurses Week, all within the very same month of May, and all caretakers, primary caretakers of human beings in this world. The bedside manner that we expect from nurses is one of the things I think that people are most critical about. And similar to teachers, we have all had very good experiences if we've been in a hospital or getting any kind of medical treatment with nurses who paid extra special attention and made us feel comfortable in a very vulnerable spot. But the complaint that we hear very often is of persons who do not possess this type of sensitivity right here within our country. The typical complaint is that it's from the foreign nurses who come into the country. And I want us to talk about this openly because it's something I'm sure you hear a lot as well. Is it a matter of a cultural difference, that Belizeans are just naturally more warm and compassionate? Or what are we missing here, and what can we do to remedy the situation?
I must agree that indeed we have been having quite a bit of complaints as it relates to that. And there are also measures that we take to address those, including disciplinary action coming from our Nurses and Midwives Council Disciplinary Committee. So there's a complaint mechanism that the public needs to be aware of so that we could address those complaints in a timely basis. We do have standards coming from nursing, and again, our lead standard or setter would be the International Council for Nurses that is based in Geneva, Switzerland. And regardless of where you're being trained, be it Guatemala, Honduras, Nigeria, and following the mandates of the International Council of Nurses Code of Ethics, you are expected to work not only with your co-workers in a professional manner, but very intricate to this whole profession is the nurse and people. Yeah. As a matter of fact, the mandate coming out of IC and the nurse and the people leads that set. So you are expected to be respectful. You are expected to give care with dignity. You are expected to provide care regardless of one's race, color, creed, sex, sexual orientation. And you are also expected to bear whatever you are being told by this patient in confidence, except when you will have to use your judgment otherwise. So those are some basic tenets in nursing, regardless of where you're being trained. And hence the reason when I talk to my nurses here in Belize, I don't like the idea of the whole aspect of the Cuban nurse and the Nigerian nurse and the Belize nurse. We are nurses doing nursing and caring for the populace of this country. So I say all this to say that regardless of where you're from, there's a mandate that guides us. There's also a avenue at which you address those derailments. And we do have the Nurses and Midwives Council Registration Act that also speaks the conduct of nurses. Your derailment of such could also have you being disciplined, with the worst being your license being revoked.
Let me just follow up there, because I think I hear what you're saying in terms of there is a code of ethics that should be prescribed to. But when I say, and that's why I said the bedside manner, because I think I can come and follow through on what the protocol is in terms of addressing a patient, but my approach is going to make all the difference between how rough I am, how abrasive I speak, and I think, like I said, maybe it's a cultural difference.
I want to agree with you there, and I travel a little bit from here to there, and from time to time. I think the answer to your question are in three parts. One, the first one I said, we all mentioned, nursing, you have to have that caring ability about yourself. And two little words that are quite often forgotten: manners and respect. And we are from a culture that used to slap the black off of you if you didn't have manners. And in our society today, that is being lost, both by the public, and that is reciprocated, because if you keep treating me meanly, rudely, without manners, there becomes a point in time where I will be eating away, and it bursts. And the other one is respect, where, first of all, quite often we find that we don't even respect ourselves. If we can't respect ourselves, then most often we don't respect others. And I'm not giving you the respect you deserve. You ought to be given. So how can I expect to get respect? So I think one of the biggest problems, and you can see that difference when it comes to a Belizean versus a foreigner. And when we go to the US, we get the same complaint from the US people, that it's the foreigners treating their people badly. Because we communicate differently, we have different manners, mannerisms, the way we interact, we respect each other differently, and you have to, at the end of the day, you have to realize that we are human beings. We would want to see our own progress.
So it seems to be, I think, obviously, that the problem is identified. And what I'm hearing from you, Nurse Elijio, is that you are speaking of the enforcement of the code of conduct that is expected. So do we find patients putting in formal complaints? Is it simply the social media complaints that we see, or are people doing formal complaints when they have a bad interaction? Because that really gives you an opportunity to address the situation.
We do get formal complaints. As I alluded to earlier, we do have a complaint policy. We have a complaint form. We try as much as possible to sensitize the public about this complaint policy and how to use it. And what we would also like coming out from that is for quality to be improved. Okay, it must not always or only be seen as a punitive measure, but for us to visit these complaints and to see how we could improve the type of care that our patients are getting.
You know, one of the things,
sadly, and it brings us again, we have changed. Our communication has changed, the way we interact has changed. it is sad to say that now, even before I get a cough, I know that I have a cough from Facebook. So more people are on Facebook, on the social media, and instead of them taking this complaint through the department, even though you advise them, okay, you have this complaint, I would like you to take this step, to create a scandal, basically. Most people would want to create a scandal, and you can get all the negative reactions you're looking for on Facebook.
So what you're saying is, we hear this with other entities as well. If you want to post it online, no one can stop you. That's your prerogative. But also use a formal complaint system, because then the entities that are responsible can do some investigate and potentially address.
And most people aren't doing that.
Yeah.
So the formal complete part, which would be the productive way to solve the problem, are not being made. Because
But you know, there must be somewhere or some way to bait people into actually using the avenue of making a formal complaint. So what are you doing to make this happen?
I must mention that as it relates to the complaint mechanism on the policy, even for rumors, we do follow up.
For rumors?
Rumors.
Oh, rumors. Okay.
So when we are seeing the posting on Facebook that is taken up for investigation and to find out what is happening, and again, we must be abreast and we must utilize what is the in thing. You know, people are on social media, so we need to be flexible. And to know how to utilize that forum also. So it's not something that is taken negatively at all times. Yeah. We see it as an avenue through which also we could get our complaints for it to be addressed.
To all our nurses who may actually be awake and watching, because maybe they came off the night shift,
yes.
I don't want them to think that we don't appreciate what they do and talking only of the complaints. In a celebration like this, and your theme is nurses, a voice to lead, health is a human right. The role of a nurse, I often see them sometimes, there's a profession called a patient advocate, but I also see nurses as patient advocates in Belize. And when you think of how important it is, that interaction that you have with your nurse, I want you to talk to me about it from the other side. Why there is this passion and dedication. You see people at their most vulnerable. They are ill, their loved ones are ill, it could be surgery, it could be celebration of birth, it could be near the brink of death. So many different situations. Talk to us about what you see as your role as nurses and what you need the public to understand, that when you're in that room, you have a specific purpose.
Well, not to take away from you, I'll put myself in that position because we live it every day. You are there as your responsibility there is to make the patient and the relative one unit to pass as fluently with as much benefit as they can get from the department through their crisis. You said sometimes it's a celebration. Sadly, we do not participate too much in the celebration. However, your role at that time becomes to step aside and to allow them to celebrate safely as much as they can. Yeah. We want people to get as much positive out of their health care as possible.
Yeah.
Of course.
The whole role of advocacy, as you rightly mentioned, is a very great role and a passionate role that the nurse must play for each and every patient. And we try to harp on that as much as possible with our nurses. I can remember working the bedside when Dr. would say, we're sending home this patient. Nurses are there 24/7. We know what is happening with that patient. Yeah. You know, you would tell the doctor, no, I don't think this patient is ready. you know, we've been seeing this, so let us see if we could care for this patient a day more, a little longer, watch what we've been observing. You know, that is just an example of advocacy. So we could do that at all levels, from the administrative right down for our patients. There's a flip side to that though. Nurses are human beings. We have families, we have loved ones. We spend very little time with them, especially now with the human shortage, the nursing shortage. You're expected to work long shift. So they spend very little time with their loved ones. Nurses are exposed to very traumatic situations. They face death every day. And yet you expect the nurse to be that superhuman, to just get up and, you know, be resilient and just move on smartly. Yeah. There are times that nurses do collapse. They do get emotional. They do get tired. So we need to know how to strike the balance for those nurses, to know when to give a time off, to know when, you know, not to be as pressuring on the nurse, so that the nurse could be, you know, ready to continue to serve. I was recently at the regional nursing body meeting in Bermuda, where we had nurses, chief nurses, under one roof. Yeah. And they were talking about the psychological support that is needed for nurses, especially in time of disaster. I hear my colleagues from Dominica, from Puerto Rico. No, we didn't have Puerto Rico, from other Caribbean islands that were affected. In some of the cases, they were affected twice. And those ladies, up to that day when we were there, were traumatized. They were crying. They were feeling pain because they were expected to continue serve when at that time they didn't have a roof over their head. They didn't know where their families are, you know, and that could bring about frustration, you know. So it's very key that we strike the balance for these nurses, so that they could continue to serve the people who do expect them to serve.
What's the average shift for a nurse in Belize?
8 hours. Most people are doing 8 hours. Quite a growing percentage now is turning towards the 12-hour shift. That's the normal work shifts. And quite a bit of nurses are now venturing into double shifts to provide coverage.
Because so they're not enough nurses, or because they want to earn more?
Yeah. They're not
enough nurses.
So you simply need to have them double up.
It's a global thing too.
Yeah.
It's a global thing.
It's a global thing. You have to look at strategies to ensure that you have coverage. Yeah. I know in the US you have flexi shift. You get nurses coming to respite, like older retired nurses coming in to help. So there are different strategies that can be looked at, so that you could ease the nurse who is constantly there prodding on and on a daily basis.
If you talk about multiple 12-hour shifts, that's looking for burnout. And obviously you need to have the nurses available, but what are you doing to mitigate what the side effects would be of this very intense workload?
There are several strategies we are looking at. Yeah. We have done a countrywide consultation with nurses in looking at the double shift, the 12-hour shift, the 16-hour shift, in which you would get like probably 3-4 days off per week on alternate week. Okay. That is one of the alternatives we are looking at. But with change comes problem. Nurses are not too receptive. You have some who are receptive, but there need to be some ways that we could have that being implemented. The whole aspect of flexi shift need to be looked at. You know, they have some nurses who would prefer to work nights. Nurses who would prefer to work weekends, you know, to accommodate them
Their
going
own
to school,
family.
their families.
Yeah.
So there are several strategies. We don't have it pat, but we need to look at it, and we also need to look at what have been working for other countries.
That's right.
You know, and to see if it would
So
help.
Well, we're so grateful that you came in to talk about what the situation is of nurses. And I think one thing that has been very clearly identified is that we need more Belizeans interested in joining the profession with the right intentions, of course, and also staying once they have studied to become a part of this profession. What would you say to young Belizeans who are graduating at this time and really trying to decide on that career path as to why you have found joy in nursing and why they might as well?
I must say, despite this profession being a noble one, it's very fulfilling.
Yeah.
It's not always about the money. I have been serving for almost 36 years because I love the profession.
Yeah.
Most of my colleagues have left. I have chosen not to leave. I want to be with my family. I want to be with my Belizean people, and I want to know that I am serving to the best of my ability. Actually, I'm retired, but
They
still
still keep you.
holding
Yeah.
the fort. For those younger ones, it's a fulfilling profession. It's not, the pay is okay. You could survive.
You can survive.
Yeah, it's okay. As a matter of fact, in 2014, the pay scales and salary have been upgraded, where nurses who have garnered a bachelor's degree, you know, would have been on a pay scale 16 like any other public servant.
Yeah.
Initially, it was at a pay scale 10.
So there are incentives.
Yeah, so
Yes, yes.
that
Want to be
is
a part of it.
one improvement that the Ministry of Health
Yeah.
had
What
encouraged.
I would like to tell the younger kids, I'll be quick, is that one, we are short. We need to do something to fix our own country. This is a way where you can offer back to your public, to your Belizean. You can stay at home, and I said the salary is not that bad. Okay, come into nursing. Be a part of a team that is actually helping to fulfill a social need to our people.
All right. Thank you so much for coming in and speaking about this profession. And most importantly, we want to say Happy Nurses Day, Nurses Week
Nurses
to all
Week.
of you, and to all, as Nurse Elijio said earlier, to all the retired and currently working and those not in the profession but who still put in their time. Happy Nurses Week to them as well. And thank you for
Thank
the
you
work
so
that
much.
you do.
Thank you very much for
We're going to
having
go
us.
ahead now and take a break, and when we come back, we'll be talking to representatives of the Belize Humane Society. So stay tuned.